Hello, this is Dr. Demerjian. The reason I'm making this video is to educate you on how to use your sleep apnea mouthpiece. By now, you should have received a box similar to this with everything in it, and I'm going to explain the parts and pieces until you can come back to the Fontana Sleep Center for me to go over things with you and do a follow-up testing. So as you open the box, there's going to be instructions from SomnoMed. Your models, impressions, everything that we did are right here. You're going to take this blue box out, and as you do, you're going to take this piece out. Underneath, you will see the impressions. Those are the molds we took. And over here are the adjusting parts that we're going to go over. So what you're going to do is you're going to open the container. Take out your mouthpiece, rinse it out, and this is what we're going to be working with. Underneath the container, if you unscrew, comes out a little compartment. If you open that, there are some tools in here. There's a tiny brush, a little J-shaped bite positioner. It may be clear or it may be a different color. And there's a tool for the adjusting part. So I'm going to go over all that with you as we go through the process. What I want you to do is take your mouthpiece, rinse it out, clean it really good before you put it in your mouth. And what you're going to notice is your mouthpiece has two components. An upper part, which has a screw type component like an orthodontic expander, a lower part that has wings. And so what you're going to do for the first week is you're going to put in the mouthpiece 30 minutes to an hour before you go to bed, just so you get used to having something in your mouth and going to sleep with it. After 1 week, you just pop them in and go to sleep. After 1 week, I'm going to show you how to make adjustments to this. So what you're going to do is, I'm going to use my little model here. The way you put this on is you're going to take the upper part, put it in, line up the two front teeth, push the front in first, and then push the back into place. Always put in the upper first, front, push the back in place. Then you do the same for the lower. Line up the lower front teeth, push the front down, and then with your fingers going inwards, pushing it into place. Then as you bite in, you will notice that your jaws protruded a couple of millimeters trying to open up your airway. When you're going to take it out, you're going to put your fingers, you're going to take the lower out first. You're going to put your thumbs at the molars, gently push up on one side and the other until the mouthpiece comes out. And then same thing, taking your index, going as far back at the molars on the mouthpiece and gently wiggling it down and taking it out. Always upper in first, front, pushing up in the back, lower front, pushing down in the back. When you take it out, you do the reverse. You pull up on the back and then take the front out. And then same thing, you go to the back molars, pull down, and then take the upper front out. All right, so let's go on. As you start wearing the mouthpiece, there may be a few side effects that you may have. This paper instructions is going to be sent to you, and I will be talking about the bite exercises and the AM aligner in a minute. So, when you take out your mouthpiece in the morning, because I haven't been able to make you an AM aligner, I have given you little bite tabs. What you're going to do on this is you're going to put it on your front teeth and bite and pull your jaw back. I'm going to demonstrate with the colored one so you can see. You're going to do it at the front teeth, and then you're going to do it at the corner teeth also. You're going to, when you take out the mouthpiece, let your jaw relax for about 20 or 30 minutes, and then start the exercise. Take the tab, put it here. Don't bite where you're pushing your jaw forward, but try to pull it back. And just gently bite into it, trying to pull the jaw back into place. And then you're going to do one corner, and then the other corner. You're going to do this for a few minutes just to loosen up the joint and try to get your bite back into place. Other than that, after you're done using this piece, If you look on the instructions sheet where it says AM aligner, if you go to number 5, I'm giving you some bite exercises. So those exercises I'm going to explain to you. The first one, what you're going to do is you're going to put your tongue up and back and let your jaw pull back a little bit and bite on your molars. So tongue, bite on your back teeth, not the front teeth. The second one is what I call the chin rest. You're going to do the same thing, but you're going to use your palm or your hand, and you're going to be pushing your chin inwards, and you're going to push it back, bite into place, pushing your jaw joint back into place to getting your back teeth to touch. You may need to do this for a few minutes. It may even take an hour or two, because I'm not able to make you an AM aligner, a bite positioner that we can index. So if and when restrictions are lifted, I will be fabricating that for you when you come back to see me at the Sleep Center. Let's go on. So I'm going to put this bite tab in there. What you're going to do, if you're wearing your mouthpiece and you're waking up rested and you're starting to feel good and no more snoring, you may not need to adjust the mouthpiece. Typically, I will have the jaw at a slightly protruded position, and we may need to go about 1 or 2 more millimeters until we stretch and open up the airway better. So if you're not if you're not waking up feeling rested or still snoring, you may need to make adjustments to your mouthpiece. Do those adjustments 1 week at a time. And if you adjust it 1, 2, no more than 3 millimeters, stop there. There are 2 adjusting parts, and I'm going to take the key right here. This thin part is for the upper. There are instructions in this paperwork to go over that. I'm not going to go over that with you right now, because we've got 3 millimeters of adjustment on the lower, which is what I'm going to show you. If you look closely at the metal here, there's an R carved into it for right side, and up here it says R0 in the plastic. L for left side, L0 in the plastic. If we come to this other little part, this container, that was 0, which is in the mouthpiece. There's left and right 1, left and right 2, left and right 3. So every time you move up 1 number, the jaw moves forward 1 millimeter. So what happens is, after a week, if you're still waking up tired or snoring, you're going to take this key. You're going to use the side where the key is standing sideways. You're going to take it, and if you look closely, there's a little hole in here. So what we're going to do is we're going to take the key, fit it from the inside, lay it flat against the teeth, and fit it into that hole. Once it's in there, with both thumbs and index, I'm going to be pinching and squeezing until I get that to go all the way through. Once that's in, I'm going to keep my thumb pressed against it. Now when I stand this key up, that wing is going to pull up. And therefore, we can just pull it right off and put on the next size higher. So I'm going to back off, put that back on, and snap it in place. And then you would do the same thing to the other side. These both are 0, and when you go 1 millimeter forward, you need to put L1, R1, both symmetrical, so it moves the jaw forward evenly. As you use this mouthpiece, you may need to be cleaning it. During the day, you can just keep it dry in the container, and all of this fits in here. And it stays in the container. In the morning, when you wake up, you take out the mouthpiece, you brush your teeth, scrub and clean this. I brought a little brush here. Use a toothbrush with a little bit of toothpaste, or you can use an antimicrobial soap like Dawn or Palmolive. Get in here, clean everything really good, and all around these little metal parts, and then rinse it off really well, put it in here. At night, you brush your teeth, whatever is on your toothbrush from the toothpaste, scrub and clean your mouthpiece, and then put them in. If you have any questions, you can reach me at area code 626-252-4683. 4398. That is my cell phone, and you would have to leave a message in order for me to return your call. Thank you.